Good afternoon. Happy Friday. Thank you, everybody, for tuning in, and thank you to everybody for your flexibility. We had to change the schedule this week to Friday. I have been in quarantine until today. I want you to know I've tested negative every single day for the past week and a half. I feel terrific, and I want to start by saying thank you. There have been so many well-wishers to me and my family as I've been in quarantine, so thank you. Thank you for your kindness. I also want to report that Dr. Alexander Scott, who did test positive, is at home today. She is asymptomatic, feeling fine, and working hard from home. She continues to be amazing and hardworking, so I want to thank her and also reassure you that she's doing well. We have Dr. McDonald here with us today to fill in for Dr. Alexander Scott. He is fantastic and no stranger, and I'm delighted to have him with us today. And I'm also joined again this afternoon by Dr. Chan, who is taking the lead on our vaccine distribution, the most exciting part of these press conferences, and I will be turning it over to him as well to give us the vaccine update. Next week, the press conference will be on Tuesday at 1 o'clock in honor of Christmas Eve, which is on Thursday, and of course Christmas Day on Friday. And then the week of Christmas and New Year's, there'll be no press conference, and then we'll be right back here Thursday, January 7th. Okay, today we'll begin as we always do with the data, and if you could please put that on the screen. You'll notice some very good and exciting news on the dashboard in front of you, which is that we actually have included a category now for vaccines. First time we've done that. As part of the dashboard, we're going to include the number of vaccine doses that we have administered. So that, for me, is fantastic and thrilling and a relief that we've begun the vaccination process. And as I said, Dr. Chan will talk more about that. Yesterday, we had 395 new cases out of a total of 9,000 tests for a test positivity of 4.4%. Obviously, the number of tests was down yesterday on account of the storm, but 4.4% positivity is good news. That is good news. A couple weeks ago, we were at 10%, and now we're at 4.4%, so we're certainly headed in the right direction. Not good news, and I say with a heavy heart, we did, though, have another 23 deaths yesterday. After a few months of numbers ticking up week after week, we're starting to see our numbers turn around and begin to trend in the right direction. You'll see the data reflected in the dashboard in front of you. For the first time in over 2 months, all 3 arrows are pointing down. That's a big deal. For the first time in 2 months, all 3 arrows are pointing down. Percent positive last week was down to 7.8% from the previous week of 9%. New cases were down from 850 to 790, and new hospitalizations have essentially leveled off. If you look at the numbers today and over the last few days, you see it isn't a fluke, and it's a trend for the past week or so. And frankly, we know why that is. It's because we hit the pause button, and Rhode Islanders listened and were fantastic through the pause. So I want to say thank you. As I mentioned last week, around November 25th, which was right before we hit the pause button, we saw mobility begin to decrease. But in the period of the pause, we've seen a real decline in mobility. People are just not out and about as much. Our R value, something we haven't talked about in a long time, but the rate of spread has been steadily decreasing since we started the pause, and it's now about 1. So each person is infecting 1 other person. We had been in a place where each person was infecting 2 or 3 other people. So that's all good news. So as a result, because people listened to the pause and took it seriously, today I'm announcing that the pause will end on Monday. The pause will end on Monday. I'd ask you, I would just say, for those of you who struggled during the pause, gyms were closed, bars were closed. I want to thank you. I know it's been a sacrifice. That's why we put financial aid right out the door to you. But it was a necessary thing to do, and it's effective. Our hospitalizations have leveled off, which is exactly what we were trying to accomplish. I told you we would keep it in place for as few days as possible, and we would lift it the minute that we could. It's been 3 weeks, and it will be lifted on Monday. If you could please put up the slide, a bit more evidence of the fact that the pause is working. It's a slide that shows how our percent positive has been moving. It shows the percent positive in Rhode Island over the past 3 months. And you can see that after 2 months of really steep growth, the numbers leveled off around December 2nd and have been in steady decline ever since. So when I was here a week ago, we had started to see a slight decrease in percent positivity, and I said I was hopeful at that point. Today, I'm relieved and pleased that the decline has continued. And so now that we are more than a week into sustained decreases in percent positivity, and we're seeing a leveling off of hospitalizations, it's clear that your cooperation with the pause has saved lives and enabled us to get control of our situation. A month ago, I stressed we were at risk of completely overwhelming our hospital system by the end of the year, but that is no longer a risk because of the pause. And I was briefed yesterday on what's happening in Los Angeles, San Diego, Southern California. They're out of ICU beds. Can't get one. Thank God that is not the case in Rhode Island. Our hospitals are stretched, and we're operating 2 field hospitals, but because of the pause and because you took action, we're in a more stable place. So I wanted to thank you for that and share where we are. Having said that, as I've said from the beginning, we can't just flick the light switch back on. It has to be a slow dial-up. And I wanted to share with you our projections for where we think we're going to go from here. So I'd ask you to please put that slide up. On your screen now is a slide showing the trajectory of hospitalizations as well as 3 projections of where we could go from here. As always, it's in our control. So in the red line in front of you, that shows what our model predicted if we hadn't done the pause. As you can see, the line just continues. It's a straight line up, reaching 800 hospitalizations by the end of the year. That would have been a level of hospitalizations we could not have staffed, and it would have been very dangerous. Thankfully, we are not going to get there because we did the pause. In the blue is what the model shows the effect of lifting the pause Monday and immediately going right back to where we were pre-pause. And you can see the effect of that, and that is not a good path. Risks overwhelming the hospital system next year. And so that's why we believe we have to have a slow dial-up, which is the purple path, the purple line on your screen. The purple line on your screen models a 3-week pause, which we've been through, followed by a slow dial-up of the economy, which is what we will begin on Monday. And clearly, as you can see, the purple line is the best outcome. It allows us to turn the dial up on the economy and get people back to work, a little more leeway for restaurants, gyms can open again, you can go back out to the gym, et cetera. but our hospitals don't get overwhelmed. So the slide before you is meant to share with you how we're thinking about it. No decision is perfect, no decision is easy, but we don't want to overwhelm our hospitals. We never want to get to a place where we have to turn people away and we have no ICU beds. So we're going to pursue the path that I laid out a few weeks ago. We're going to end the pause on Monday. We're going to slowly start to dial up our economy. And all of the new rules around restrictions can be found right now on reopeningri.com. So if you can go to reopeningri.com, it lays out all the new rules which start on Monday, and there's a question and answer section in case you have questions. I will say there's nothing new there, though. This is exactly what I forecasted a week ago. The news for today is making it official. Pause ends Sunday, reopening begins Monday, and again, it's a slow dial up, so we hit that purple line. I will say this. There is no certainty, there's no pure certainty around exactly where we go from here. And it depends on some factors. So how we all behave over the holidays is a huge factor. If we all have large social gatherings without masks on, crowding around the Christmas table, without masks on, big family gatherings, if we travel a lot, then we're going to get into trouble again, and we may have to go back to a pause. On the other hand, the vaccination rollout is a good thing, and that is in our favor, so hopefully that might enable us to do even better than that purple line. And we won't know for sure for some time what impacts the factors will have, but what we have to do now is focus on what is in our control, and that is the key. The name of the game now is protect your household, stick with your household. That is the key. Continue to limit your social gatherings to your household. If you want to go Christmas shopping or shopping, great, go, wear your mask, go alone or with the people you live with. If you want to go out to dinner, great, with the people that you live with. So there's a lot that's out of our control right now, but there's some things that are within our control, whether we wear our masks and whether we stay with the people we live with. And so that's what I'm asking us to do to protect our household through the holiday season, which, by the way, includes Christmas. And that's hard. That is a hard message for me to deliver. It's a hard message for me to deliver to my family, my friends, and the people of Rhode Island. I had to deliver that message for Easter and Passover and all of our Thanksgiving, all of our holidays. And we had hoped that Christmas would be different, but unfortunately we are where we are. So we're all going to have to reinvent our family traditions this Christmas. And I'm asking you, please, to celebrate with the people that you live with. And bear in mind that outside is much safer than inside. And of course, you want to be wearing your masks. And again, I'm asking you, the best thing we can do to protect our household in the coming weeks is to limit our social interactions with the people that we live with. So try not to travel to see people. Don't host a big party at your house. It's hard to hear. Things will be different. I promise you next Christmas will be better, and we can have all of our family over, and New Year's Eve will be better, and we can have everybody over. But this year, I'm asking you, please, try to keep it local, keep it small, hang out with the people that you live with, keep it outside, and wear your masks. I also want to thank all of our faith leaders for your exceptional leadership, collaboration, and partnership. I know this is a very important time of year with Christmas and Hanukkah and year-end celebrations. I understand, as a Christian myself, Catholic myself, the solemnity of Christmas Eve and Christmas Day. I want to recognize the Catholic Church. They have said there will be no midnight mass at the cathedral this year. That is a big step, and I want to thank you for your leadership. There'll be no midnight mass at the cathedral. There will be extra masses on Christmas Eve and Christmas Day so that people can spread out. All of the faith leaders are going out of their way to keep their parishioners safe. More services, virtual services. I can't thank you guys enough. You've been outstanding partners, and God bless all of you. Next year, I hope we can fill the cathedral for Christmas Eve and Christmas Day and all the other places of worship around Rhode Island. Now, in addition to staying with your household, the other thing you can do to protect your household is to go get tested. I want everybody to go out and get tested. Get tested next week, and then get tested the week after that. Just go ahead and do it. Getting tested is simple, incredibly effective, free, and will protect your household. We're making it easier. I know a month or two ago there were lines for testing. Some people were getting frustrated that they were having to pay. It's a different story now, and I'm asking you to please go get tested. You won't have to wait in line. It won't cost you anything. It's easy. You won't have to give any information that you don't want to. It's safe. It's one of the simplest things you can do to protect your household. So over the last month, we've made a lot of changes. And as a result, everybody in Rhode Island can go get tested for free. You can schedule your own test at portal.ri.gov. Portal.ri.gov. It doesn't matter if you have symptoms or not. If you have symptoms, you definitely should get tested. If you don't have symptoms, you ought to go get tested. It doesn't matter what community you live in, what you do for a profession, how old you are. We really are asking everybody to go get tested. In the past week alone, we have increased capacity at the Wickford train station. So if that's convenient for you, we have a lot of capacity at the Wickford train station. Stop and Shop locations in Cumberland and Newport. We opened a test site just today in North Providence at the old Public Safety Complex, classic Rhode Island, the old Public Safety Complex in North Providence. Go there and get tested. We've continued to ramp up capacity at the Dunk. Go to the Dunk. Go to the Dunk. It's, for those of you who don't love driving into Providence, I'm going to tell you there's free parking, there's no line. We have capacity to do 5,000 tests a day. We're doing 500 tests a day. So come on down to the Dunk and get tested. You'll be in and out in 15 minutes, 20 minutes. That's what people are reporting. You can get a same-day appointment. Just please go ahead. And by the way, get it done next week and the week after and the week after. In an ideal world, we'd all be getting tested once a week, once every 10 days. Especially if you are planning to travel over the holiday or get together with folks, which I hope you don't, but absolutely, if you are going to be doing that, get tested before and get tested after. If you're going to go to church, if you're going to do Christmas shopping, hopefully you get the gist. Just go get tested. To make it even easier for you, we're going to try to meet people where they are in the next week. So starting now, we are launching a very aggressive, in the community, holiday testing strategy, and we're going to be setting up pop-up sites all around the state. We want to make this super easy. We're going to go where we think you will be. So we'll be at the mall. We're going to try. So, by the way, I'm saying this because if you're going to go out and do your Christmas shopping, or if you're going to be going to church, or doing grocery shopping, or et cetera, you're probably going to see a testing table. Don't be alarmed by that. That's for you. It's free. It's easy. Get a test. You'll have a result right there in 15 minutes. Simple, easy, free thing to do that protects your family. So don't be surprised if you go to the Warwick Mall or Garden City or Roger Williams Zoo for the drive-through lights display and you're offered a test. I'd ask you to do it. Do it. I've done it dozens of times. It's not going to hurt. You'll have a quick answer right there. And then if you're positive, you'll know you have to go stay at home and isolate. It'll protect you and protect your family. So this weekend, we're going to be at malls, retail stores, gyms, grocery stores, senior high-rises, big apartment buildings, churches. We want to meet people where they are. We'll be at Stop and Shops, we'll be at the Arcade in Providence, we'll be at Chapel View in Cranston, the Warwick Mall, Farm Fresh, Rhode Island. There's going to be a full list of these sites on the Department of Health's website. So if you're eager to know where they are, go to the Department of Health and you'll see the list. But otherwise, as you're out and about doing what you need to do with people you live with the mask on, go ahead and get a test. Add 15 minutes to your shopping trip. If you are a retailer or a business and you're hearing me say this, and you would like to become a pop-up testing location, we'd love to have you. You can go to info@commerceri.com, info@commerceri.com, and we'll happily see if we can set up a site there. By the way, all of these pop-up testing sites are free. You don't need an appointment. So, as I said, I can't say it enough. Our goal is to perform more than 20,000 tests with these pop-up community sites, which are going to be open starting this weekend. And I hope it provides you with peace of mind, and it's something that it costs nothing and it could save a life. Okay, in addition to the holiday testing, we're also launching another targeted testing effort for schools when the kids return to school in January. Earlier this week, we announced an updated school calendar, giving school leaders some flexibility next week and the opportunity for a ramp up to full in-person in January. We expect all schools to begin bringing the kids back by January 7th, and we want everybody back in person by the 15th. That's an approach that worked well in the fall. Now, there'll be many schools, public, private, parochial, that'll be ready on January 7th to take all the kids back, and that's great if you're ready. But we also know it's not easy, so that we're allowing for a ramp-up period between the 7th and the 15th. The Education Command Center is working around the clock to ensure every school has the resources that you need for January, including they're going to be distributing over 6,000 HEPA filters and helping schools implement the Department of Health's guidance. So, you know, it'll be a heavy lift, as it has been from the beginning. And I want to thank teachers, school leaders, superintendents, custodians at these schools. Thank you all so much for your incredibly hard work in doing all that it has taken to educate our kids through coronavirus. And as we look to January and the ramp up, we want to support you in every way that we can to make sure that the kids can get back in January. To that end, we're going to be incorporating much more testing of students and teachers in January when we reopen. We have heard a lot, particularly from teachers, around the desire to have just regular asymptomatic testing, and we heard you, and we're going to deliver. In January, we're really going to ramp up in-school testing of teachers and students on a regular basis, even if you don't have symptoms. And that's going to be in addition to the K through 12 testing line, which has been working very well. But we're going to be starting to, in January, we're going to be using the Binax tests, which are just the kits, no equipment. It gives you a result in 15 minutes throughout our schools. We've started piloting this to great effect over the past few weeks. We've done pilots in Providence, Lincoln, Central Falls, and South County around testing entire schools. And so far, it's been a huge success. Central Falls was the first community to launch the pilot. They've seen a positivity rate of about 1% in schools. Great news. And most encouraging is that after help from the Department of Health and the EDOC, these schools are starting to do additional testing on their own. In the three schools, they've managed by themselves, they've done it all on their own in Central Falls, they've tested over 300 people and had only 2 test positive. So that's fantastic. I have to say, I have to pause for a minute to thank the Central Falls Superintendent, Dr. Stephanie Downey Toledo, who has done just a phenomenal job in getting the kids, you know, and the faculty to the facilities to get tested. And she's also talking to her peers around the state to help them replicate what has happened there. So there's 2 pieces of good news in that. One is, you know, I've been up here week after week, month after month, saying it's safe to be in school. That this is very clear data. Even in Central Falls, which is very dense and has the wide community spread, in the schools, in the communities, it's 1%. Secondly, help's on the way. We're going to get out there in January and do what we've done in Central Falls across the state. Much more testing on a regular basis of everybody, teachers and students in the buildings. So we've reached out to all of our district leaders with options for single-day, wide-scale testing events, like a big testing event of the whole school, or regular testing where students and staff are tested in school on an ongoing basis. I want to thank superintendents. It's been a great response over the past 10 days. 10 districts have opted for a testing event where we take the day and test everyone in the school. 10 districts opted for the regular testing every week, and 21 districts opted for both. That's the best news. So I'm excited. You know, I'm excited for this. Our goal is to use 30,000 tests every week in our schools, and that's starting in January, and that's on top of all the other tests that we'll be doing at the testing sites. So we're going to be starting as soon as the spring semester begins in January, and the high-density communities, Central Falls, Providence, Pawtucket, will be at the top of the list. So I know it's been a really, really tough semester. Again, I want to thank teachers, students, parents, superintendents, and principals. I hope that this testing gives teachers and parents and students a little more peace of mind that starting in January, we're going to have regular testing on-site, rapid results, much more widespread. Finally, one more announcement today relates to nursing homes, another group that has been hardest hit throughout this crisis. I have been asked at this press conference several times about essential caregivers in nursing homes, and I'd like to address that today. This week, we gave nursing homes the green light to allow essential caregivers to take care of residents. So essentially family members. So if you have a family member in a nursing home who needs help with grooming, bathing, eating, etc., you, as a family member, can sign up to be an essential caregiver to your loved one. It's an initiative that has been happening in a number of other states. The Department of Health has looked into it extensively, and they've just given the green light to nursing homes to do this. Now, I want to emphasize, this is up to the nursing home. We are not forcing this on any nursing home. Nursing homes have their hands full, and we want to be supportive. However, it's a path to allow family members to visit safely and take care of their loved ones. Any essential caregiver, anyone who gets qualified as an essential caregiver, has to go through a training program run by the nursing home, and of course is going to be bound by the same testing, screening, and other COVID requirements of nursing home staff. And the good news is that now that we're really ramping up our testing, we're going to have the capacity to test everybody regularly who steps foot in a nursing home. So as we end the year, I know this time of social distancing with restricted visitation at homes has been a huge stress on families, on residents, on staff, and I hope that this does a little something to ease the pain on you and your loved ones.